like that. I felt on the scene.
Opening door. I'm gonna close the door, okay, guys? Alright. How you guys doing today? Good. Okay, I'm student Dr. Carter. What I'm gonna do is wash my hands real quick. So, what you guys up to today? Just hanging out, or?
Well, we're at the hospital, so
Oh.
not hanging out pretty well.
Okay. Well, nice to meet you. What's your name?
I'm Charles.
Charles, and
I'm Ellen.
hi, Ellen. Now, you look really familiar. And
Yeah. So I'm from the Athens area. I think I might have seen you before.
I know where I saw you at. I saw you at the farmer's market 2 weekends ago.
Yeah.
Was that you? Okay, you guys were both there.
Yes.
That was pretty awesome. I bought something from a couple,
You know, we sell some good tomatoes, you know.
Yeah.
Much better than Kroger.
Okay, so I do want to know what's going on. Why are you up here today?
So I have this cough, and I cough, and I cough, and I cough. And last night was really bad, so Miss Ellen here made me come in.
He wouldn't have come in if I didn't drag him here.
Oh, okay. So can you tell me when it started?
A couple years ago, I guess.
A couple years.
It started 15 years ago.
15 years ago. All right, so if you were going to show me anywhere it hurts the most or you're feeling that cough coming from, can you point it
It's
out?
just deep in my chest. Like it's pretty much both sides. One side's not better than the other. It's deep.
Okay, all right. How long does it typically last?
So I'm a farmer and I work out in the fields. I have wheat fields and soy,
Mhm.
and sometimes we have cattle. But during the morning, it's not too bad. During the middle of the day, if I get working a lot, then I'll have a coughing fit. And when I come home, I just cough and cough and cough in the evening.
I know it's going to be frustrating.
It's not great.
Yeah.
Very frustrating.
All right, so I know you said it was kind of deep in your chest. Is there a particular way you would want to describe it? If you're going to choose one word, how would you describe it to me so I can get a better idea?
Annoying, but just dull,
Dull.
probably.
Okay.
Dull and annoying.
Anything that makes it better?
I like to drink hot tea.
I make it for him every night.
Every night. So that means you're
It's
having that
just the
feeling
best.
every night.
Yeah.
Okay. Anything that makes it worse besides working in the fields?
Just being active. Like if I try to do a flight of steps, I'll go into a coughing fit.
Alright, I'm just jotting down a couple of things so we can run through
Yeah.
this a little bit later. Alright, and I just want to know if does that feeling, that pain that you're feeling in your chest, does it kind of radiate to your back? Does it go to your arm? Does it to
No,
your
no, it just stays right in my chest.
Okay.
And I cough up stuff sometimes. It's
What are you
not-
coughing up?
There's phlegm, green stuff. Sometimes there's a little bit of red flakes in it, but
Alright.
I think it's blood.
Okay, I think so too a little bit, but we can look at that in a little bit. And I do want to ask you how much it hurts. Scale of 1 to 10. 10, the worst thing ever.
if it's only 1 or 2 coughs, it's probably a 3. But if I go into like a 5-minute long, it's like an 8 or a 9 towards the end.
I'm gonna listen to you. I know the nurse already came in and took a couple of your vitals, and she listened to you, but I'm gonna listen to you again so I can hear it for myself a little bit.
Okay.
With your vitals, it does look like your blood pressure's a little bit high.
Yeah, I have medicine. Sometimes I take it.
Sometimes.
He never takes the hydrochlorothiazide.
Okay, sometimes turned into a number. Okay. So you got So, do you have any past medical conditions I should know about?
Yeah, I guess just the high blood pressure.
High blood pressure, cancer, diabetes?
No. My father had a stroke.
Mhm.
He died at 68 years old, but my mother's still living and kicking.
Okay. And any past injuries?
When I was a teenager, I broke my arm, but
Okay.
that was a long time ago.
It's still important to me. And what about any past surgical history that I should know?
I had my wisdom teeth out when I was a kid too, but
Alright.
like I said, that was a long time ago.
Okay. And you are on hydrochlorothiazide, but anything else?
No.
Vitamins?
I don't, am I? I
He
don't-
doesn't believe in vitamins.
Okay.
Yeah.
What about your immunizations? Are you up to date on those?
Oh, Lord, no. I think my, one of them, tetanus shots I had about 15, 20 years ago when I cut my hand on a nail.
Okay.
And then I don't believe in the flu shot. I don't get the flu, I don't get the flu shot.
Okay. You're entitled to that. Any allergies?
think so, no.
Okay, so I just want to ask you a couple more questions about your day-to-day living so I can get a better idea where maybe this golf is coming from, okay?
Okay.
And you're welcome to chime in because you know Charles
Oh,
is more than
my
anybody
Miss
else.
Little Ellen, she'll chime in whenever she wants to.
Oh, I will.
So, in terms of caffeine, day-to-day basis, we're talking tea, soda.
So I definitely have a cup or two of coffee in the morning.
Okay.
I have a Mountain Dew with lunch,
Okay.
and then my sweet tea in the evening.
All right. So you're drinking all of them, tea and soda. What about alcohol intake? You know, day to day.
I have a beer at dinner and a couple on the weekend.
We're like 2 or 3 beers at dinner
Okay.
and 5 beers a night on the weekends.
I like to have fun, you know.
Okay. Got it. We'll get a range in there. We'll do a range. All right. And any tobacco smoking?
Yeah.
Mm-hmm. How long you been smoking for?
I've been smoking since I was about 13.
13.
Yeah.
How many cigarettes or packs?
Maybe a pack a day.
One pack a day.
Used to be 2 packs a day.
Okay, so we're having some improvement. And what about any illicit drugs? Weed,
Nah, we're pretty
heroin?
boring.
Okay.
Can't afford drugs.
And what do you typically do? Are you doing anything else besides working in the fields? Anything else?
Not really. I mean, I really, really like football, so I try to go to like the local high school games and
Okay.
things.
All right. So I'm going to ask you a couple more general questions just to review the systems here.
Yeah,
Talk about
sure.
your heart, your respiration. Have you had any fevers, chills, or weight change lately?
I can't say fever or chills, but I have noticed that my pants are a little looser. They used to go up to a certain belt loop, and now they goes 2 over.
Okay.
He's definitely lost weight.
Okay. And do you feel any differences in your heart? Is it ever racing when you're sitting down? Do you feel any palpitations through your chest?
Nah, I don't think so.
Okay. And what about breathing? Are you having some trouble?
Yeah, when I'm climbing steps and when I'm getting those coughing fits, and especially at nighttime.
So I'm going to shorten some breath a little bit.
Oh, yeah.
Doing these activities. All right. And any diarrhea, constipation, nausea?
Nope.
And, all right, so what I want to do is just listen to your heart real quick, listen to your lungs a little bit,
Okay.
and we can talk about what's going on.
All right, definitely. Am I okay right here?
Yeah, you're fine. If you want to come out a little bit, that's fine.
Okay.
I'm also going to check your back just for differences in your tissue texture and motion texture as an osteopathic manipulative medicine aspect.
Oh, my back's a mess. I'm a hard-working man. My back's always
He
messed
is.
up.
All right, I'm just going to ask you to relax. Right over here. Thank you. All right, and then I want you to take a deep breath in. All right, another one. All right, another one. One. Last one. All right. All right, so I'm hearing a lot of coughing when I'm listening to your lungs. A little bit of wheezing. And based on what we're looking at here, I'm a little concerned that you might have COPD.
Okay.
Okay.
That sounds really serious.
Do you
Is
know
it really serious?
Well, it stands for chronic obstructive pulmonary disease. Okay.
Okay.
And it typically happens with those who smoke for a long extended time. You're up there now, so since you've been smoking since you're 13, you got a little bit of years in.
Yeah.
It's okay. What's going to probably make this difficult is that it's something that doesn't really have a cure, but you can manage the symptoms. Okay. What I want us to do is kind of work together here as your physician, as your support system, and you yourself.
Okay.
Okay. I know you work in the fields also, and that kind of is making it difficult.
Yeah, it's
Right.
really hard. I've noticed it's just getting really difficult.
Yeah. One of the things that I want to suggest is that we kind of bring down the time you're spending in the fields.
Okay.
But I think that might be difficult for you because you're still going to be
It is a little bit, but we have a lazy, no good for nothing son we can put to work.
We can definitely put him to work.
Might be able to
That
take a
might be
look.
one of your options. I also want to just look into, when you come back next time, so I really want to look into maybe releasing a little bit of tension and pressure in your lungs.
Okay.
We can probably do a little bit of OMM or osteopathic manipulation just to, release some of the fascia in there and some of the tightness in your chest, because what we want to do is let your lungs expand as much as they can, because right now what the difficulty is that you're not getting enough oxygen in, okay? And every aspect of your body needs a little oxygen. So
Right.
you're decreasing that, you're having trouble with your heart, trouble, getting up the steps, and, just using that type of energy.
Yeah.
We do have a couple other options. Do you know what a bronchodilator is?
I don't.
It's basically open up those airways for you so you can bring in a little bit of oxygen, but it's up to you what you want to do.
Okay.
We can stick to just changing a little lifestyle aspect, wearing looser clothes. I know your clothes are loose now, but wearing looser clothes so we're not pressing on our, the chest, and maybe just changing a couple of, eating habits, eating a little healthier, plant-based diet, just to make sure we're taking care of your health in that.
Yeah, definitely.
So I'm not sure, what would you be interested in first? Maybe just the lifestyle changes, or going straight to bronchodilators? And
Yeah, so I definitely like the idea of trying a conservative approach. But like you said, this isn't going anywhere, so I do definitely want to schedule follow-ups to
Okay.
keep up kind of a consistent relationship with you, and then we can just build on what we
Yeah,
need to do.
I think that's a good option, and we can keep working together and, figuring out, tweaking what we're doing and tweaking our treatment. So do you guys have any other questions for what we're talking about here?
Do you have any handouts we can take so we can
Yes.
study up on that?
There's a couple handouts at the front. I can direct you out there when we get out there, because we can all walk out together if you're ready for that.
All right.
Anything else? Do you have any questions?
No.
Okay. All right, well, let's get out there and sing. We can, I guess, ask the questions, like, we've got some questions back here.
Do you want to ask yours
Yeah, so I was just kind of curious what, because we really focused on a rural patient. So in your guys' profession, how does a rural patient differ from someone who isn't rural? I guess.
One of the biggest things that nutrition professionals look at is access to healthy food. So when you're in a rural setting, it's hard to find certain foods that you need for nutrition therapy. So that's definitely an additional factor that we would look at.
Definitely, just stereotyping, I guess, like the patient when you said, oh, plant-based diet, and then he was just like so for it, like that often doesn't happen when we suggest plant-based diet, so yeah, that was just
Accents, I think, is something, especially when we're assessing and we're using these standardized tools that don't look at the Appalachian dialect or even words that are used, that maybe wherever the Central American accent, which isn't even like a thing, ends up being what people use to score, and then you have to kind of know what words you're gonna have to, like, what words are gonna be considered okay, even if they're not the ones that are in the book.
One of the things we talk about in the social work program is like the ethical code in the rural setting. I'm sure it's, if you, like myself, I was born in the Appalachian region and then have now become educated in the Appalachian region and plan and intend to work here. Odds are that I'm going to provide services to somebody that I went to school with, somebody that I used to know. So there's suggestions within the NASW's code of ethics, how to handle those situations, and it kind of lies on the professional to set those boundaries. But that's one of the things, especially with social work, when you're providing services to these people, if you have a client on your caseload who's the only transmission shop person in town and your car needs a new transmission, what are you going to do? You can't say, well, my ethics are in violation here, so I've got to drive my broken down car 3 hours to get a new transmission. So that's just something we talk about a lot, is like maintaining our ethical code in a setting where dual relationships might be unavoidable, you know? So, yeah, oh yeah. And like, Athens, people say that, and they're like Portsmouth, where I'm from, it's even smaller, it's like micro Athens. So,
I think even in terms of access, if you're talking about follow-up appointments, we have a lot of people who have to cancel or who have trouble, showing up for follow-ups. If it's a transportation problem or if it's just other things that are going on, if they have to drive for an hour just to get to their appointment, I don't know, we're around like 23, 24% no-show in our clinic, so
I was,
significant.
like talking to some people with tasks for like an internship interview type thing. We were talking about they have the ability to provide transportation and pay for it through a grant. If you're a client that like works with them, they will transport you, which is kind of like new, or I haven't seen it in any other really counseling settings. But he said when they were writing this grant, like the people, and he calls them the people in Columbus, the people in Columbus told him, well, we'll just give them all bus tokens. And he said, well, then you'll have to give us all buses. Like it doesn't, we don't have that here. And I think that's something that happens all the time. Like people have solutions, they're like, well, this works for us just fine. Like, well, you see, we don't have any buses to use with the tokens, so we're kind of just, I got a bunch of, it'd be like having like the gold coins you put in games at the arcade and trying to buy stuff from the store.
Good analogy.
You know what I just thought about was,
What?
as a dual relationship, a lot of our teachers are doctors at campus care. And it's, sometimes you're like, you know what, I'm not gonna go to campus care.
That is very.
You're just kind of like, who do I go to for this particular concern without seeing